How do new breast cancer therapies work? Imagine a treatment that targets cancer cells with precision, sparing healthy tissue, and offering new hope for patients. That's what many of the latest breast cancer therapies aim to do. These therapies work by focusing on specific biological mechanisms that cancer cells relying on to grow and survive. Unlike traditional chemotherapy, which attacks all rapidly dividing cells, these new approaches are designed to be more selective, reducing side effects and improving outcomes. One major advancement involves combining targeted drugs that block key pathways cancer cells need. For example, some therapies focus on the PIK3CA mutation, which is common in hormone receptor-positive breast cancers. Drugs like inavolisib specifically inhibit this mutation. Others, like palbociclib, are CDK4/6 inhibitors that stop cancer cells from dividing. When combined with hormone therapy such as fulvestrant, these treatments can significantly delay disease progression. They can postpone the need for chemotherapy by nearly 2 years, helping patients maintain their quality of life longer. Another exciting development is antibody-drug conjugates, or ADCs. These are like guided missiles that deliver chemotherapy directly to cancer cells. They consist of an antibody that recognizes specific markers on cancer cells linked to a potent drug. For example, trastuzumab deruxtecan targets HER2-positive breast cancer, while sacituzumab govitecan is used for triple-negative breast cancer. Because ADCs deliver the toxic drug directly to the tumor, they tend to cause fewer side effects and can improve how long patients stay free of disease progression. Immunotherapy is also making strides in breast cancer treatment. Some new therapies combine ADCs or chemotherapy with immune checkpoint inhibitors like pembrolizumab. These drugs help the immune system recognize and attack cancer cells more effectively. For instance, in cases where the tumor expresses PD-L1, combining sacituzumab govitecan with pembrolizumab has shown to reduce the risk of disease worsening compared to traditional treatments. This approach leverages the body's natural defenses to fight cancer more efficiently. Photodynamic therapy is another innovative option. It uses special chemicals that accumulate in cancer cells and become active when exposed to specific light wavelengths. This activation produces reactive oxygen species that kill the cancer cells. Recent advances include using cyanine carborane salts, which improve the precision of this therapy. It can target aggressive tumors with minimal damage to surrounding healthy tissue, making it a promising option for hard-to-treat breast cancers. Researchers are also exploring nanomedicine, which uses tiny carriers to deliver drugs directly into tumors. These nanocarriers can respond to the tumor environment and releases their payload precisely where needed. They can also trigger different forms of programmed cell death, such as ferroptosis and disulfidoptosis, which are new ways to kill cancer cells that are resistant to traditional treatments. Combining these approaches can enhance the destruction of cancer cells and stimulate the immune system to recognize and attack tumors, especially in aggressive subtypes like triple-negative breast cancer. In summary, these new therapies work by targeting specific molecules, boosting the immune response, and improving how drugs reach cancer cells. They are helping to make breast cancer treatment more personalized, effective, and less toxic. It's important to remember that the best treatment depends on the type of breast cancer, genetic factors, and individual health. Always consult with healthcare professionals to determine the most appropriate approach for each person. These advances representing a significant step forward in the fight against breast cancer, offering new options and hope for many patients.